Good morning, everyone. Today we are going to discuss a topic called as hypoxia. This is a very important topic in the first year MBBS, which you will study. First of all, we will see the definition of hypoxia. Hypoxia is nothing but the deficiency of oxygen at the tissue level. This deficiency of oxygen may occur due to the various reasons. So there are mainly four types of hypoxias classified on the basis why deficiency of oxygen is occurring at the tissue level. First of all, we will see the hypoxic hypoxia. It is the first type of hypoxia. Second is anemic hypoxia. Third is the stagnant hypoxia. And last one is the histotoxic hypoxia. First of all, as we will elaborate one by one the hypoxias. First of all, hypoxic hypoxia. The name itself says hypoxic, means there is decrease in partial pressure of oxygen, due to which there is deficiency of oxygen. The second one is anemic hypoxia. As its name itself is suggesting that anemic hypoxia, there is anemia or deficiency of something which is causing hypoxia. In anemic hypoxia, there is deficiency of hemoglobin, due to which the oxygen is deficient at the tissue level. Then there is a stagnant hypoxia. As its name is also suggesting that stagnation of the blood flow causing the stagnant hypoxia. Then another one, last type, is histotoxic hypoxia. As its name is also suggesting that it is due to some type of toxicity of the tissues, due to which it is causing deficiency of oxygen. So let's elaborate the types of hypoxia. Here we have come up to types of hypoxias. There are mainly four types of hypoxias, as we have seen in our last slide. First one is hypoxic hypoxia. As we have all seen, decrease in partial pressure of oxygen causes deficiency of oxygen to the tissues. This is called as hypoxic hypoxia. So, where we will see the hypoxic hypoxia, the most common example is seen in high altitude. In high altitude, we can commonly see the hypoxic hypoxia, because in high altitude there is less partial pressure of oxygen, due to which decreased partial pressure causes hypoxic hypoxia. Ventilation perfusion mismatch also causes the hypoxic hypoxia. There is the diffusion defect. As we have seen, the diffusion membrane consists of mainly three layers. Due to diffusion defect, the partial pressure of oxygen may decrease, and this may cause hypoxic hypoxia. As we have seen hypoxic hypoxia, now we will see anemic hypoxia. Decrease in the hemoglobin concentration of blood causes anemic hypoxia. As the name itself is suggesting that there is anemia, some sort of deficiency. So here the deficiency is hemoglobin. So we will see if there is less hemoglobin to carry the oxygen, then there will be less supply of oxygen to the tissues, hence resulting in anemic hypoxia. It is as simple as it is. So it is seen in anemia, overall decrease in hemoglobin. Then it is seen in carbon monoxide poisoning. As I will elaborate this example, in carbon monoxide has 210 times more affinity than oxygen for binding with hemoglobin. As we can see, carboxyhemoglobin, it will form carboxyhemoglobin in case of anemic hypoxia, and it will bind. So there will be no space for oxygen to bind with hemoglobin. This will cause anemic hypoxia. Second example and last example is methemoglobin formation, which will again stop oxygen to bind to the hemoglobin. So the third type we will see is stagnant hypoxia. Stagnant hypoxia is stagnation of blood flow or less blood flow or decreased blood flow. Why it is caused? It is caused due to the various reasons. As we all know, stagnant hypoxia is also called as circulatory hypoxia. The stagnant hypoxia is seen in various cases such as shock. In shock, we can see the stagnant hypoxia. In heart failure, there is stagnation of blood flow. The heart cannot pump the adequate blood, causing to slow blood flow. This leads to stagnant hypoxia. The last one is vascular obstruction. If there is obstruction in the blood flow, this will also cause stagnant hypoxia or stagnation of blood. And coming up to our last type of hypoxia, this is histotoxic hypoxia. Here the blood supply is adequate, but the ability of tissue to utilize the oxygen is decreased. So why it is decreased? Due to the tissue poisoning. So in which cases the tissue poisoning is seen? In the cyanide poisoning. In the cyanide poisoning, as we know, cyanide is inhibitor of complex of a electron transport chain, which prevent the oxidation. This leads to inability of tissue to utilize the oxygen. This will leads to tissue poisoning. Last one is diphtheria. There is diphtheria toxin which causes inability of tissue to utilize the oxygen. As we have elaborately seen types of hypoxia, now we will see it's a flow, it's a table, as it will help you in your exam. First of all, there is hypoxic hypoxia, low arterial partial pressure due to decreased oxygen in environment, as seen in high altitude and defective ventilation perfusion ratio. Second type, as we have seen, anemic hypoxia, less amount of hemoglobin to carry the oxygen. It is as simple. Total hemoglobin count is less, causes anemia, hemorrhage, formation of hemoglobin. So stagnant hypoxia, rate of blood flow to tissues is reduced. Why it is reduced? Due to obstruction in blood flow and heart failure. Last one is histotoxic hypoxia. Normal oxygen delivery to the tissues is compromised due to toxic gases such as cyanide poisoning and diphtheria. As you can write this table and you can secure the full mark. This is the way of representation you can do in your university exams or in your term exams. As if you will represent any topic in such a manner, the examiner will need less time to read this, and he will surely impressed by your representation and answer, as all topics are covered in a very short manner and all aspects of it along with examples are covered in such type of flowchart. You should use it in your exams to ace. So this is all from my side. Thank you for watching, and I can send you notes in the link of this video's description. So if you like this video, thank you.